On the way home from the hospital, just 10 days after receiving a new healthy liver from a 15-year-old boy who I didn't know, I asked my wife to stop by the supermarket. I asked if she would go inside and buy 4 12-packs of Coke and other soda drinks. I had been a health nut, and sugary drinks were not part of my program. But now I was so thirsty, and had been since the surgery. I was also hungry. I began to gobble hamburgers and endless junk food. I had had a liver transplant after being diagnosed with cancer, a malignant tumor on the liver, the result of being infected with the Hepatitis C virus. 6 months after the transplant, I was preparing for the first Christmas of the rest of my life, sitting on the floor, eagerly wrapping gifts in my office at home. Suddenly the phone rang. I recognized the caller ID as being the hospital. I braced for the news. Despite the transplant, the Hep C virus had come back, stronger than before. I went on an aggressive treatment plan with a variety of drugs that required me to self-inject 3 times a week in my abdomen. I had chronic Hep C, likely from an infection I received some 30 years earlier. I had heard that sometimes an organ recipient takes on the lifestyle and personality traits of the organ donor. Well, I had certainly undergone a change after that operation. In time, I exchanged letters with the donor's family. I was not surprised then that he was a skier, snowboarder like myself, and very active in the outdoors. After 15 months of lying in bed, nausea and headaches, I was well. The Hep C virus has been absent from my system for over 2 years now. My liver is healthy again. Now I ski in the winter, ride a bike in the summer, and otherwise fish, hike, or ride a skateboard when I can. As I take the last swig of a can of Coke, I wish that I could talk to this fine young man who at a young age was mature enough to understand that he could save a life.